Hi, my name is James Roberts. I'm a patient care coordinator here at FindHelpForCancer. We understand that some of you may be looking for just complementary treatments to what you're currently already doing with traditional treatments, or you may be looking to have something that simply takes the place of. These will be all discussions with you and the doctor. We're happy to help, point you in the right direction, and answer questions for you. The videos are meant to help aid you in your healing journey. Please like and subscribe so that we can help others.
Common cancer myths and the integrative truth. Let's discuss 14 common myths people believe about cancer, debunked with current science and supported by insights from integrative oncology. 1. Cancer is always a death sentence. This is definitely not true. I hear and speak with success stories weekly. Plenty of people with a cancer diagnosis get their lives and health back. Many cancers are highly treatable, especially when caught early. Survival rates have improved dramatically due to advances in treatment, early detection, and personalized medicine. An integrative approach can further support the immune system with therapies such as high-dose IV vitamin C, which may help reduce inflammation and oxidative stress, enhancing the body's natural defenses during treatment. 2. Cancer treatment is worse than cancer itself. This is not always true. While treatments like chemotherapy and radiation can have side effects, modern medicine has made them more tolerable. Many patients recover well and live full lives post-treatment. Integrative doctors use supportive therapies such as high-dose IV therapy and dietary strategies to reduce treatment side effects like fatigue, nausea, and neuropathy, improving overall quality of life. 3. Only people who smoke get lung cancer. This is false. Most of the lung cancer patients I speak with are not smokers. While smoking is the leading cause, non-smokers can also get lung cancer due to genetics, radon exposure, pollution, or other factors. Detoxification support and antioxidant-rich IV therapies may help reduce oxidative damage from environmental exposures. 4. If no one in my family has cancer, I won't get it. False. Most cancers are not inherited. Only about 5 to 10% of cancers are strongly linked to genetics. Lifestyle, environment, and random mutations also play a big role. Integrative cancer care focuses on lifestyle modification, detox, and immune support to minimize non-genetic risk factors. 5. Breast cancer only affects women. False. Men can get breast cancer too, although it's rare. Awareness and early detection are important for both sexes. Integrative care includes hormone balance assessments and personalized nutrition to address contributing risk factors in both sexes. 6. Cancer is contagious. Completely false. I was once asked if they could get cancer swimming with a cancer patient. Cancer cannot be caught from another person. It's caused by genetic mutations in a person's own cells, not by viruses or bacteria that can be passed from one individual to another. However, chronic infections like HPV or hepatitis can increase cancer risk. Integrative practitioners may focus on strengthening the immune system to prevent viral-related cancers. 7. Positive thinking alone can cure cancer. False. While a positive mindset can improve quality of life and mental health, it is not a substitute for medical treatment. Cancer requires medical intervention. That said, positivity can help patients cope and stick with treatments. I'm a big believer in the power of prayer. I have seen the positive effects that prayer can have with cancer patients. Spiritual support, prayer, and mindfulness practices are part of holistic care, helping patients mentally and emotionally through their journey. 8. There's already a cure for cancer, but it's being hidden by big companies. False. I think it is just more complex than a single cure because cancer is so complex. Scientists and doctors around the world are actively working on treatments, and advances are constantly being made. I do believe we will one day see this happen. Integrative oncology does not promise a miracle cure, but offers a comprehensive plan combining conventional treatments with therapies like high-dose IV vitamin C, hyperthermia, and immune support to optimize outcomes. 9. Cancer always comes back after treatment. Not true. Many people are completely cured of cancer and live cancer-free for the rest of their lives. Others may go into long-term remission and never experience a recurrence. Long-term wellness plans in integrative care focus on immune health, detoxification, nutrition, and stress management to reduce recurrence risk. 10. Cancer can't be treated once it is spread. Not always true. I have spoken with over 25 to 30,000 patients and hear success stories all the time. It is very inspiring. While metastatic, stage 4 cancer is harder to treat, it's not untreatable. Many people live for years with advanced cancer thanks to targeted therapies, immunotherapy, and other modern treatments. High-dose IV vitamin C, when used alongside conventional therapy, may help improve quality of life and reduce tumor burden in some patients. 11. You can't get cancer if you live a healthy lifestyle. This is false. But I wish it was true. Healthy living lowers your risk, but it doesn't eliminate it. Genetics, age, environmental exposure, and chance can all play roles. Even athletes and clean eaters can get cancer. Integrative care emphasizes prevention and regular screenings, even for those who are healthy, along with anti-inflammatory nutrition and detoxification. 11. If you don't feel sick, you don't have cancer. Not true. One thing cancer loves is when you give it more time. Many cancers, especially in early stages, don't cause pain or noticeable symptoms. That's why screenings like mammograms, colonoscopies, and Pap tests are so important. Integrative practitioners often perform in-depth functional lab testing that may reveal early imbalances before symptoms arise. 12. Cancer always causes weight loss. False. While unexplained weight loss can be a symptom of some cancers, not all patients lose weight. Some even gain weight due to treatment-related changes, hormone shifts, or inactivity. Nutritional counseling and IV nutrient therapy and integrative care help maintain strength, correct deficiencies, and support metabolism during treatment. 13. If you're vegan or plant-based, you won't get cancer. False. I do wish this was true, but I speak with people almost daily that eat plant-based and have lived clean, healthy lives but still get cancer. Being plant-based may lower your risk for certain types of cancer, but it does not make you immune. A plant-based diet rich in vegetables, fruits, legumes, and whole grains is associated with a lower risk of some cancers like colon, breast, and prostate. However, cancer is influenced by many factors: genetics, age, environment, inflammation, chronic infections, stress, and even chance mutations, not just diet. Some non-meat diets may still consume processed or sugary foods that offer little protection. A plant-based diet may lack key nutrients like vitamin B12, omega-3s, iron, and zinc if not carefully planned. Nutrient deficiencies can weaken the immune system over time. We can all be exposed to toxins, pollutants, radiation, and other environmental risk factors that contribute to cancer. A well-balanced diet can be a powerful part of an integrative cancer prevention or treatment plan, but it's just one piece of the puzzle. Regular screenings regardless of diet, stress management, detoxification, and spiritual well-being are all part of the big puzzle. And lastly, number 14, high-dose IV vitamin C is alternative and unproven. Not entirely true. High-dose IV vitamin C is not a cure, but has been studied for its potential to reduce inflammation, improve quality of life, and act as a pro-oxidant against cancer cells when used alongside standard treatments. Therapeutic dosages could be up to 100 grams. It should always be administered under medical supervision, ideally by an integrative oncologist familiar with both conventional and complementary therapies. Other IV therapies and targeted supplementation used in integrative care include IV therapy like B12, D3, omega-3s, just a few of the high-dose IV therapies that may be suggested. High-dose IV vitamin C to support oxidative balance. This could be up to 100 grams. IV glutathione. This is your body's master antioxidant. IV zinc and selenium. Myers cocktail. IV B complex and B12. IV CoQ10 and vitamin D3 with K2. Mistletoe therapy. Not IV, but injectable. Integrative cancer care is not about choosing between traditional and natural medicine. It's about combining the best of both worlds. By integrating medical science with supportive therapies like high-dose IV vitamin C, mind-body practices, nutrition, and spiritual care, patients often experience reduced side effects, improved emotional well-being, enhanced recovery, greater sense of control, and hope. If you're interested in exploring integrative care and personalized IV therapy options, visit FindHelpForCancer.com or call us at 928-546-5963. We're here to support your healing every step of the way.
I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at FindHelpForCancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.